Welcome to Deuk Spine Institute, live stream spine surgery, April 3rd, 2025. I'm Dr. Deuk Majin. Our patient here is from Canada. She has traveled here for bilateral piriformis shot and bilateral L5-S1 disc herniation repair. We've just completed the Deuk laser disc repair, L5-S1, on both sides, for a large annular tear, disc herniation, with pressure on her nerve roots of L5 and S1 and back pain. That's completed. Now we're moving on to her piriformis release. She has torn piriformis muscles on both sides, and they are causing pain in the top of her buttock and also symptoms down her leg. So what we're going to try to do today is go in and basically release the torn muscle to get the pressure off, the tension off the muscle, and hopefully let it heal that way. So to do that, we're making a 4mm incision. That incision is going to be just over the greater trochanter of the hip. And we do a lot of these surgeries now because this is a very common problem, believe it or not. Lots and lots of people have this problem, and they don't want to live with this horrific pain that comes about from this condition. So, Henry, let's show the audience what we're talking about while we get ready to do our first release.
Copy that.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deuk piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Deuk piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes, minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
All right, welcome back. You can see from our animation video that our goal here is to release the muscle off this part of your hip called the greater trochanter. The only downside to this, there is no downside, but it's that it hurts for a few weeks afterwards, up to a few weeks afterwards. Most patients, the pain is gone from the procedure, usually within just a few days, but it could be a painful procedure. Everybody's a little bit different. It is a muscle after all, and muscle, when you're cutting a muscle, it's more uncomfortable than cutting anything else. As a matter of fact, for years I did spine surgeries like fusions, and everybody thinks the screws and rods cause pain, but they don't. And people think that cutting the bone causes pain, but it doesn't. It's really the muscle pain that lasts for a long, long time. Any questions from our audience?
Yes, we have a question coming from Lanu on YouTube.
Sean?
Asking, does your arm feel sore when holding the scope for a long time?
Great question, Lanu. My arm does not feel sore. As a matter of fact, I don't feel sore at all. These surgeries are, to be honest, much physically less demanding than, say, a fusion, which I used to do all the time. Other types of neurosurgery. Neurosurgeries are pretty long surgeries, whether they're brain surgery or they're spine surgeries. Most of our surgeries are really long, like many, many hour surgeries. So this is kind of a blessing to have a short surgery, like just an hour or so. So it's not bad at all. All right, we're making our way down to the second piriformis muscle. This is her right side. The left side went very well. Then this first step is docking my probe onto the back of the hip, the greater trochanter, the posterior facet, and that is the first step that has to be done. That's what I'm working on right now. And this is a very, very slippery area, by the way. I've been doing many of these. It's all right. It's my fault. And basically, I can tell you that that bone is super slippery when you get to the back of it. It is, I mean, literally slippery, slippery, slippery. Shot. All right, we're there. Any questions?
Yes, we have a question coming from Charlie on YouTube,
Hi, Charlie. Welcome.
asking, why are you able to realize your approach phase transforaminally without removing any pieces of bone, while other surgeons do find it necessary to clip bone for decompression?
Yeah, because they don't need to clip bone. So Charlie asked a good question. How come I do my surgery without removing bone while other surgeons say they have to remove bone for decompression? Because the other surgeons, honestly, I don't know how the best way to say this. I don't know if it's lying to you or how you want to call it. Luis, what should I say? Misleading you? Lying? I'm not sure what the right term is. What do you say when a person tells you something that isn't the truth? I mean...
Misguiding?
Yeah, I mean, I feel like lying is intentional, but the truth is some of these surgeons truly believe what they're telling you. They just don't know. They don't know the truth. They've never done my way, and so if they did it my way, they would realize you don't need to remove bone from the spine in order to unpinch nerves and fix the problem.
Brandon just said...
Go wash your eyes right away. Go now. Go. Rinse your eyes. There's an eye rinse station. Go. Right away. Sorry, go ahead.
No, Brandon said it could be a misinterpretation of facts, in a way.
Yeah, misinterpretation of facts. But I don't know that the surgeons are misinterpreting the facts. They just that's what they believe to be the case and the truth. But they telling their patients that maybe because they believe it, but it's not true. So if I just say it's a lie, which it is a lie, but and it's not a lie, intentional lie, that seems kind of mean. So long story short, the surgery you watch me do with the scope, transforaminal, no removal of bone or ligament, is 100% effective in every single patient at eliminating back pain and leg symptoms. The only thing we've not been able to 100% eliminate is drop foot when they come in with the nerve is completely permanently damaged. But you don't know if it's permanently damaged till after the surgery. So it doesn't matter what surgery you do, that nerve is not going to recover. But if it's just pressure on the nerve, removing the disc herniation is the only thing you need to do. What am I doing here? Oh yeah. So just so you guys can see the size of the incision, this was a bilateral piriformis release, but before that, we also did the Deuk laser disc repair at L5S1. Thanks for joining us. Are there any other questions?
No current questions.
All right. Have a wonderful afternoon. I guess we have one more case to go. So we have another bilateral piriformis release, which will be broadcasting in about 30, 40 minutes.